evening and hello. My name is Renee D. Waring, and I am the founder of Uniquely and Wonderfully Made Ministries, where we purpose to change the hearts and minds of the public by putting forth evidence to support the assertion that people with mental illness have value. I welcome you all, and I especially welcome the new members of my community. I am glad to be able to speak with you this evening. The title of my presentation today is COVID-19 and Men's Mental Health. The Cleveland Clinic survey was done which sampled 1,000 adult males ages 18 and older from across the United States. 77% of the men reported that their stress levels increased during the pandemic, while 59% said that they felt isolated. About 45% reported that their emotional and mental health declined during the pandemic. It is not all bad news. The results show that 45% felt healthier during the pandemic than before the pandemic, while 28% were sleeping more and 22% were adding more exercise to their routines. About 19% said they were eating healthier meals. Men have more difficulties with addressing their mental health that can impact their physical health in turn, said Dr. Pektar Bajic. He is one of the doctors associated with the campaign and a urologist at Cleveland Clinic's Glickman Urological and Kidney Institute. He said, quote, I encourage all men to talk to their partners, talk to their support system, end of quote. Quote, findings from Cleveland Clinic survey were in over 3/4 of men are experiencing increased stress levels, and nearly half are reporting that their mental health has worsened during the pandemic. Is consistent with what we are seeing in the clinical practice, unquote, said Dr. Michael Young, service chief of the Retreat of Shepherd Park, a psychiatric hospital in Baltimore, Maryland, the suburb of Tulsa. Men in the past just had a primary role of breadwinner. Now, during COVID, they are having difficulty in adjusting to new and different roles, such as increased caregiving responsibilities or helping their children adjust to remote learning while keeping up with online work and household chores. Their self-esteem and sense of purpose has been severely impacted because they no longer able to provide financially for their family in many cases. Quote, isolation from important aspects of social networks such as work colleagues, friends, and extended family have also been contributing to feelings of loneliness, which is a well-known factor that can contribute to negatively to both mental and physical health, Young said. Men don't seek help because they believe that asking for help is a sign of weakness. They want to be perceived as being strong and not vulnerable. Quote, it is important to shine a light on shame and guilt that men may be experiencing, reframing the narrative to emphasize that asking for help is a sign of strength, not weakness, may help more men to be willing to ask for help when they need it, unquote, said Dr. Young. Telemedicine is an accessible and less intimidating way to engage safely with mental health professionals. A phone or virtual appointment from home could be an easy way to begin to address health problems and medical professionals. In the survey, 50% of the men reported being less healthy and 50% reported being healthier now. Those who reported worse health habits were more likely to increase their alcohol consumption, for instance, and lean into more sedentary behavior. Quote again, it's about how people deal with difficult times. It's important for men to talk things through and use their support systems, use resources that are available to them in terms of dealing with stress in a healthy way, Bajic said. Thus ends my presentation for today. I'm glad to have been able to spend this time with you all. I hope that you found my talk to be both interesting and informative. My next talk will air on the second Friday of next month. Please join me and ask your friends and family to join the community so that they can view the video also. One can join by going on my website, uniquely and wonderfully made ministries.com. UNIQUELY and wonderfully made ministries.com. Uniquely, UNIQUELY and wonderfully made ministries.com, and filling out the contact form. Please view the blogs and library videos on the site. My email address is mirecovery74@gmail.com. It's M as in Mary, I as in ice, the word recovery, RECOVERY 74@gmail.com. I repeat, M as in Mary, I as in ice, the word recovery, RECOVERY 74@gmail.com. Please email me your questions, concerns, and prayer requests. Invite me via email to come to your group meeting to speak with you on a hot topic on mental illness. I am the founder of Uniquely and Wonderfully Made Ministries. My name is Renee D. Warren, and I am the warrior warring.